I'm here today with Dr. Stephen Sinatra. He is a leading integrative cardiologist, nutritionist, and anti-aging specialist. I am very pleased to have Dr. Sinatra back here at this table, talking with me about how to find an integrative or complementary cardiologist. Dr. Sinatra, welcome.
It's good to be here, Donna.
There's a lot of interest in this subject, in finding an integrative cardiologist such as yourself, somebody who practices both traditional and alternative or anti-aging medicine. But it seems so hard to find somebody like this. Why is that? Why is it so challenging to find somebody like yourself?
Oh, Donna, tough question. I'll tell you, if you look at myself, I graduated medical school in 1972, took 3 years of internal medicine training, took my boards in internal medicine, did 2 years of specialized training in cardiology, took my boards there. Then I decided to go into psychotherapy training and got certified as a psychotherapist, and that took 10 years, Donna. That was a lot of work. Then I thought I didn't know enough about nutrition. Then I got the certified nutrition specialist degree and spent 2 years studying that, reading the journals, reading the books, taking the exams. And then I spent another 4 or 5 years about anti-aging medicine. So if you add up the years, it's pretty tough. But it's even harder now because now, for a board-certified cardiologist to go through what I went through, now it takes 3 years of internal medicine, and now instead of 2 years, it takes 3, 4, or 5 years of subspecialization in cardiology to get board certified. So now a cardiologist has to spend longer time. Does he or she have the time to learn about mind-body, learn about detoxification, learn about nutritional healing? It's hard. So I feel bad for these doctors who are putting in all this training, but they're only trained halfway. So it takes a huge commitment to do the training, stretch yourself, and to really learn about this other world of alternative medicine. And I've been fortunate. I've been blessed. I've been in it since 1978. And I truly feel that it's the best thing that's ever happened to me.
A lot of time has gone into becoming an integrative physician. But isn't it true that there's still a mindset that traditional medicine is the best way to go, and there's still a fair amount of skepticism about alternative medicine and blending those two fields together? Does that notion still largely exist?
Absolutely, but it's getting better. Let me explain. If I had a heart attack, I would want to be stented on the spot. Increase coronary blood flow. Why mess around with, pain medication and IVs and IV magnesium? Just stent me. Bypass me if my life depended on it. If I was in a car accident, fix me. If I have a child with asthma and they can't breathe, adrenaline, corticosteroids, whatever it takes to break the child. Conventional medicine has a role, especially in emergency medicine. But where we fall flat on our face is with chronic illness. We don't even understand what causes chronic illness. Once we get at the cause and associate, how to really, neutralize those factors that cause illness, then we're going to be treating symptoms. And that's what we do in our society. Pharmaceutical drugs treat symptoms. Headache, belly pain, hypertension, hypertense, increased blood pressure. So we have to get out of the mindset of treating the whole patient and not just treating the symptoms.
Dr. Sinatra, what do you think is the catalyst needed to really change that thinking? That traditional medicine, yes, do that when it's necessary, but let's embrace alternative medicine. What needs to happen in this country to cause people to really align with that?
Well, doctors can do what I did, and look, I'm training all the time. I'm 64 years old, and I'm still going to conferences, and I'm still learning, and I'll probably learn until the day I die. But if I had to do this all over again, I would go for a naturopathic degree and a medical degree. And basically what I've been doing is I've been approaching medical schools and like Bastyr University, which teaches naturopathic medicine, and I want to blend the philosophies together. And why is that? Well, the first 2 years of a naturopathic student and the first 2 years of a medical student, they take the same books. They use the same books. They study anatomy, physiology, pharmacology, microbiology. And the best of both worlds would be that if a naturopath does his thing and a medical doctor does his thing, if you blend them, Now you have a doctor of the future. Now they have more bullets in their gun. Let me explain. A naturopath studies all the same things a medical doctor does, but he or she learns herbal medicine, energy medicine, nutritional healing, foods that heal, osteopathic medicine, we call it manipulation medicine. But the greatest weakness of a naturopath is they don't do a residency or a fellowship. So they don't spend time in hospitals. They don't see sick people. What happens to the medical doctor? He or she does training, postgraduate training. They're in the emergency room, ICU, CCU. So they're treating sick people. But what's their Achilles heel? Pharmaceutical drugs. They rely on pharmaceutical drugs. And Donna, it's a dinosaur in the year 2010. We have to consider that. So the doctor of the future is to blend these philosophies together. And I say, hey, look, if you got an ND degree or an MD degree and you want to flip over, well, erase those first 2 years of training. Instead of making it 8 or 9 years to get both degrees, make it 6 years.
So it sounds like you're saying this really is a fundamental issue that rests with the universities and the institutions in this country to try to get this curriculum right so you can blend these two things together. Is that what I'm hearing?
That's what you hear. In other words, let's not be so rigid in one discipline and rigid in the other. Blend them. Because look, if I was an MD, ND, and you came to me and you were sick, I wouldn't reach for my prescription pad for the first intervention. I would say, hey, look, maybe you need to change your diet. Maybe you got too much toxins in your body. You know, maybe you need some nutritional healing or herbal healing. Oh, wait a minute, you've got blocked energy in your meridians. Maybe you need some acupuncture. Oh, if you need pharmaceutical therapy, sure, I can give you that. So that's the doctor of the future.
How does the average person make that decision, though? How do they know when it's in their best interest to have a doctor who practices both traditional and alternative medicine?
Well, they can ask the doctor, you know, they can look at their diplomas, see if they had kinesiology, you know, any courses in herbal medicine or energy medicine. I mean, it's important, but usually when they see a doctor like this, he or she will have a different aura about themselves. Let me give you an example. A cardiologist doctor that I see or would see would be Dr. Delaney in Boston, Massachusetts. He has the same training I have, board certified in medicine, board certified in cardiology, using CoQ10 for 30 years just like me, but now he's learning electrodermal testing, a form of vibrational medicine where you hold on to an electrode here, you hit acupuncture points here, you put a computer in the middle, and that determines, you know, what frequencies are in your body. For example, if you have heavy metal toxicity with mercury, well then, if you put mercury on the screen, it would show up that frequency and you know to neutralize it. Jim Roberts, another integrative cardiologist out in Ohio, he's a wonderful man, and his big thing is on biochemistry of what we call methylation pathways. There's cardiologists all over the place in this country that are on my top docs list. I call them top doc cardiologists, that if I could clone myself, you know, I would clone, you know, Delaney in Boston, Roberts in Ohio, you know, Dr. DeVries in Chicago, other doctors in, Dr. Elkind in California. I would do that. But we got to find more of us, you know, and that's the key. Because I think the best way of treating cardiovascular disease is to blend the best of both worlds. I mean, I've seen miracles happen.